What's up, YouTube? I know it's been long overdue that I give you guys an update on how I'm doing. I figured now's a good time because it's been about a year, a little over a year since I had my surgery. Apologize for not getting back to your questions. I will show you the reason why. Hello, hey, come here.
Come here, you crazy. Come here. All right.
So, I got this little guy. How old are you now? Huh? 14, 15 weeks? So, yeah, he's my little Alaskan Klekai. He's basically like a miniature Siberian Husky, and he's still obviously a puppy, so he's quite a handful. And I don't really have a lot of time to do much anything else besides trying to get some resemblance of work done and make sure he's not chewing or pooping and peeing all over the place.
Say hi to the people. Say hello.
All right, chew on your bone. Yeah, so just recently he's good enough to kind of let me be in the office here, which is a welcome relief. But I apologize again for not getting back to you guys. I'll be much better about it going forward. I've got quite a I guess build-up of questions that I know I need to get back to you and answer. So I will do that. Look for those in the next couple of days. I know some of you had said you had surgeries coming up and wanted to know how I was doing. I'm doing great. I would do it again if I had to. If you want to see my scar, you can barely see it now. And I can pretty much do everything that I could do before it without any problems. I lift weights. I pretty much train everything except legs twice a week, so I'm in the gym 5 days a week. I'm playing with him and holding him, and before that probably would have irritated my arm. In fact, I still haven't had anything done in my left arm, and it sort of irritates my arm if I'm holding him for too long or something like that. So I'm still going to try to give you guys some relevant tips and content because, again, I haven't had it done in my left, and I'm trying to, just as I'm sure all of you guys are, and girls, that's just a figure of speech, trying to delay having to have it done for as long as possible. I'm going to, maybe try some different things with my left arm that I might not have tried with my right to see if it helps. It seems, the nice thing is a lot of what would irritate mine was working on the computer and stuff like that. And, the good thing is I can mouse with my right hand and it doesn't really bother me at all or, any of that stuff. Again, I think I told some of you guys that how mine was done, it just sort of worked out in a way that if I fully extend my arm, supposedly it pops back to the original place that it was transposed from, so basically on this side of the bone. But even though it does that, I still don't really have a lot of issues, because I guess it's had time to heal. And don't get me wrong, there's a certain combination of things every now and then that'll give me some slight tingling in my hand, but I never have pain anymore here. I never have pain. I might get slight tingling in my fingers. In fact, the other day, I think it was a combination of, playing some guitar and doing some yard work and, whatever with him. And I was working on the computer and I was mousing a lot and I kind of was like, I get a tiny little bit of tingling there, but it's not that bad. And, if it gets to the point where it's getting really irritated on my left arm, I won't hesitate to get it done. But again, I know a lot of people think that just because I talk about how successful my surgery was with my right arm, I'm telling everyone to go out and get surgery. And that's absolutely not the case. If you can do conservative things that help, by all means do it. And that's exactly what I'm doing with this arm. If there's things that you can do that prolong, your need to have surgery. I guess the bottom line is if you're doing something to try to alleviate some symptoms and it's working, then stick with it. It doesn't matter what it is, And if you have some new stuff, by all means tell me, because I still have it in this arm. So, I'm going to, one thing I haven't tried really is any kind of dietary changes or anything like that. And maybe supplements or whatever. So I'm going to do some research on that, see if there's anything out there that could potentially help. I mean, none of the things that you do conservatively are really going to, reverse it or stop it. But I think some of it might, decrease inflammation or create an environment such that when you are irritating it, it's not manifesting in symptoms, be it pain or numbness or whatever. So maybe there is, maybe there isn't. Again, I spent 5 years trying to kind of get around this one. And, for the most part, some things that I did had some decent effect. I think when it got to the point where I had to use the speech recognition software and I really couldn't mouse around, it's kind of hard being a marketing professional to do anything with that kind of stuff. I mean, I was able to do quite a bit, but it becomes kind of a pain in the butt. So, but for all you guys that are doing it, or looking to that as a means around it, it's totally doable. In fact, I kind of miss having the speech recognition software thing. If you're working from home or you have your own office, it kind of works. I had my own office at the last place I was working at, and it was okay for that, because I kind of would close the door because I didn't want it picking up other people's conversations. So I sort of needed that, and I didn't want everyone hearing what I was typing, all emails and whatever. But if you're working from home, it's no big deal. But yeah, if you're sitting in a cubicle right next to somebody else, then yeah, it's kind of like, I wouldn't want to do that either. So anyway, I'll get back to you with answers to your questions. I'm doing great. I'm going to, still make videos answering questions that you guys have. And I think I'll try to make some more along the lines of things that you can do conservatively to try to get around the problems that you're having, be it in your daily life, eating, whatever, holding a phone, whatever, or working, or I know a lot of you guys find me play guitar or work out, so those sorts of things. I've got some maybe that I haven't shared before that I will, but again, my apologies for taking so long. It's been kind of a hectic last couple of months. So, but again, just to let everyone's mind at ease that does have one of these surgeries coming up, it's nothing to worry about. As with anything in life, it's the unknown factor that is the scary part, right? Like maybe you haven't had surgery before, maybe you're like worried it's not going to come out good, this and that. It's like the likelihood of any of that stuff happening is very small, and it's once you go through it, you're just like, why was I worried at all about this? So as I always say, find a surgeon you're comfortable with if that's the route that you have to go at this point, and at least that will help you be more comfortable going into it. You don't feel anything. I would say that people dealing with this experience more pain in their daily life than you will after surgery, because as long as you stay taking the pain medications when you're supposed to, the pain doesn't really set in too much afterwards, and the recovery time, especially for a subcutaneous transposition, is pretty quick. Submuscular takes a little longer because they cut the muscles, but if you guys have questions about that, I'm pretty sure I have some videos that sort of talk about the differences between those. But anyway, I just wanted to say thanks for the ongoing interactions. It always helps me to kind of remind myself of there's other people that go through this, and that's sort of what I always created this for, to serve you guys as sort of a way to relate and ask questions and help each other out. So keep the questions coming. I will answer them, and look for more videos that'll hopefully be helpful to all of you. Okay? Thanks a lot. Aloha.